Welcome to Healthcare by the Numbers, a podcast that uncovers what's driving healthcare transformation. Join us each episode as Caravan Health, now part of Signify Health, industry experts interview the brightest minds inspiring healthcare innovation and discuss the numbers which have shaped their thinking.
Welcome, everyone. I'm your host, Patty Ballman, Executive Vice President of Value-Based Care at Caravan Health. I'm pleased to be hosting Healthcare by the Numbers podcast live in San Diego at Caravan Health's 6th Annual Symposium for Accountable Care. Today I'm joined by Marcus Lanznar. Marcus is the Senior Vice President at Signify Health for Product. Welcome.
Great. Happy to be here.
Yeah, happy to have you here. So Marcus, today we're going to focus this podcast on a conversation around numbers, impacting industry today, particularly around in-home evaluations and the benefit it has for our patients, our providers, and health plans. We know that Signify Health has a significant footprint in this area, and primarily in the Medicare Advantage market. So we'd like to learn more about that. Some of the statistics that I think are astounding is 1 out of 3 Medicare Advantage beneficiaries have very little options for healthcare out of the home. It is astounding to hear those numbers. So we want to get your perspective on the in-home evaluation and the value it brings to care and the care delivery model in the communities.
I think the kind of foundational way to think about this is that everybody feels most comfortable in their home. Mm-hmm. And, if anyone has ever, unfortunately, had to go to the hospital or even be in their doctor's office, there is a level of trust that one feels in their home, a comfort level that one feels in their home, and an access to care that is just more comprehensive in the home. Mm-hmm. And so when we think about meeting people where they are and where people want to be, that's in the home. And the fundamental value that you get from walking into someone's home is just a differentiated experience and a level of trust, honesty, and a widening of the aperture of understanding what's going on with that patient's lives. Mm-hmm. And so when we send one of our 10,000 skilled clinicians into a patient's home, we're able to see not just the medications they're on or their conditions, their symptoms, their gaps in cares, but what their life is like on a day-to-day basis. And when we really think about treating patients holistically, we want to know everything about them. And so there's just a depth of understanding that comes from being in a patient's home that you don't get really anywhere else.
Yeah. And I imagine, in the home, you can really get a sense of safety in the home, equity, food security, those types of things that you would not normally, you wouldn't normally get that in an office visit.
Yeah, absolutely. Speaking of numbers, when we think about our broad kind of spectrum of doing this millions of times every year, walking into patients' home, it doesn't sound like a lot, but 1 or 2% of the patients we see have an emergent issue that needs to be addressed at that moment. And those are ones that either the patient was unaware of or didn't think was serious enough. And, our teams triage those, get those patients to care immediately. That's a serious impact and kind of a profoundly important thing. But on top of that, 1 in 5 have a need for something that is clinical or social, that's a gap in their care. And not just, we talk to patients and helping them understand medications, but these are gaps where there's a fall risk in the home. Mm-hmm. There is a transportation need. There's a food insecurity. And while these are not what we think of as traditional clinical needs, these are true social and patient needs, and we can't expect the people we love and the people we care for to be, clinically healthy if we're not taking care of them holistically.
That's correct, yeah. And I know, in the senior population in particular, there's, polypharmacy where patients are taking many, many medications, and you get, your clinicians get to see how they're managing those medications in the home, if they're taking them, if they're, a lot of times they say they're taking them, but when you go into the home and you see the bottles and you see the systems they're using, it's easy to have an event related to medication management.
Yeah.
Here.
Yeah. I mean, from personal experience, no one wants to feel dumb and no one wants to feel uncomfortable. And what that truthfully means is that in many cases, patients are talking to their doctor and they're asked, do you understand? And yeah, of course. Like, I have personally done that and I know that. And then you're at home and you maybe don't, or you've forgotten something. Yeah. And our clinicians are able to spend a significant amount of time walking through what those medications are, how they should be taken, if there's a financial burden that needs to be alleviated in order to get their medications. It's just a level of depth in conversation and understanding what's going on with that patient that doesn't exist, unfortunately, in many cases in other aspects of our healthcare system today.
Yeah. So the work that you're doing in-home evaluations right now is in the Medicare Advantage market.
Primarily, yes.
Primarily. How can you take the great processes in your clinicians throughout the country and apply those same principles of those in-home evaluations to accountable care organizations?
Yeah. It's a great question. And at the highest level, as we think about providing extensions of care and solutions for those people who are operating within healthcare today, what we want to do is we call it a multi-payer solution, but the truth is it's just treating every patient like a patient and helping a provider treat every patient they see. And so the next logical step for us was going into the Medicare ACO space and being able to deliver in-home wellness visits on behalf of providers and ACO participants. And it's the action that we are doing is very similar, but because it's a different space, we're able to deliver care, support that ACO, and deliver a continuity of care. And it allows us to be closer to the patient and the provider than we do traditionally with the health plan, which is a really incredible and powerful space for us. We talk a lot and we think a lot about being an extension of care and providing continuity. What we focus on is the patient's relationship with their physician is critically important. And we want nothing more than to help be a facilitator of that and to ensure that that patient is regularly speaking and seeing their physician. While we know that unfortunately today physicians are not making house calls anymore, but we can extend the care that those physicians can provide by supporting patients and going into their home and providing a depth of analysis and understanding of those patient situations, getting that information back to that physician, allowing then that physician to have a broader, more holistic understanding of what is going on with that patient's life, allowing them to provide better care, which ultimately lowers costs and benefits both that specific patient and, in this case, the ACO in general, or broader healthcare systems in general.
Excuse me. That feedback loop back to that primary care provider certainly, I think, is an added advantage. You're right. In the systems today, it is very difficult for any of our primary care clinicians to actually get out in the home. And it's not that they wouldn't want to, it's just the system. And having that feedback back to that, as you said, creates a more broader scope. They get insight that they normally wouldn't have just by that regular annual wellness visit.
Yeah.
And
it's an 45-minute, an hour-long, in-depth conversation in that patient's home, which just provides, like you said, a depth of information and understanding that doesn't exist in many of the interactions that are happening today. And it is providing a more holistic set of, care. And it's, we talk a lot in this country about a physician shortage. We're feeling it today, like more than we have, in a long time, about a healthcare and clinician shortage all over the place. And at the same time, given the administrative complexities of our American healthcare system, we're asking physicians, provider groups, practices to do more every day, and to do more clinically, and to do more administratively. this is a solution that we feel really proud of because it allows clinicians to be clinicians while helping them be better clinicians and helping drive a more comprehensive support system for those patients that they're caring for.
So you spoke about and mentioned the network of providers that you have. I think you mentioned 10,000?
Give or take.
Give or take 10,000. So you have the ability to pretty much touch every community across the country?
Yes. We the benefit of our size, our scale, our national presence, and what we tell all of our clients, all of our prospective clients, everyone we work with is that we are in your county. Mm-hmm. We are in every county in America every year. We see, we're going to be in the homes of millions of patients every year. And what we do with our clinicians are incredible. And, they are here doing this to help patients. Mm-hmm. And we make sure the clinicians go to the patients, and we will, our routing and logistics, we will move our providers, we'll put them on airplanes, we'll put them in hotel rooms. Our goal is to meet patients where they are, and that means if that's in a rural county somewhere, we're going to go to them. If they're in a city, we're going to go to them. Mm-hmm. And so it's a differentiated offering that we have because of our national scale and scope, that we are able to support any organization, any provider group, mm-hmm. and ensure that we can get a highly skilled clinician into that member's home wherever they are.
So when we use the term clinician, we're referring to, in Signify's case, primarily physicians, correct?
Physicians and nurse practitioners,
correct.
Highly skilled,
yeah.
master's level clinicians, yes.
That's wonderful. That is wonderful.
We're spending 45 minutes or an hour in the patient's home with that patient, with their caregiver, understanding their situation, seeing the way that they are living, seeing the challenges, the barriers that they have towards their active daily lives, and what is preventing them from being more active, from being more healthy.
So you mentioned that occasionally you'll find something during that in-home evaluation that triggers that needs immediate attention. So in the case of those, your clinician, Signify Health's clinician is in the home and they discover something that needs immediate attention. So, and then is that a phone call back to the primary care provider in the ACO space?
Yeah, so that would be the second phone call.
Okay.
The first phone call is, what are we doing about this patient? And so, yes, the first phone call is, now in some cases it may be the first one, but in a case of a serious condition, if someone is having a heart condition, we're going to get 911, we're going to get the ambulance there, we're going to figure out, these are physicians, these are highly trained clinicians, mm-hmm. They're going to identify something that's serious, they're going to ensure they figure out what needs to be done, mm-hmm. And as soon as that patient is triaged, yes. They're going to get on the phone and they're going to call that physician and they're going to say, your patient has just experienced X. They are on their way to this facility, this hospital, whatever the situation is. Here is what's going on. This is a true care team acting as a care team and ensuring that we deliver the best results for that patient.
So it is truly a continuum-based strategy that we're developing, a workflow around that patient, which is remarkable. So when you think about the patients that are in the ACO, is there a certain subset of patients that, would be better served by an in-home visit versus actually, coming to the doctor's office? Or is it something that everyone could benefit from?
Yeah, it's a great question. So I'll answer it in a couple ways. The first way is yes, absolutely everyone could benefit from this. I mean, we fundamentally believe that more care and ensuring you can see what's going on in a patient's home is going to be extremely valuable. That being said, this is never going to be a replacement for seeing your physician and going into your physician's office. Mm-hmm. And so these are not and or solutions. It's really just an and, mm-hmm. right? We want to ensure that no matter what happens, and that's a good call out, is after every one of these visits, a standard procedure is we schedule that patient back to see their physician every time, because we want to ensure that after we're in the home, that patient is back talking to their physician, and that physician has what has happened in the home and can see anything that has been identified, can talk to that patient about those to get those issues, those potential care gaps resolved.
Right. You can really incorporate a more comprehensive plan of care for that patient.
Exactly.
Gives them more insight.
Exactly. And then in terms of, right, what patients are, right, this is the very, positive thing about us being a service organization here to support providers is we work with every type of client, every type of organization, and there may be patients who live far from clinics who don't want to come in. There may be patients who historically are reticent to come get care. Those are great, hard to reach, high-risk patients to do that. There may be physicians or groups of physicians within an organization who are understaffed, overworked,
right,
who don't have the time. The annual wellness visit is a significant time requirement,
Yes,
who don't have time to do those or who prefer not to do those because they're so busy. That's a great, that in itself is not great. It's a great opportunity for this.
Yeah, it's a great alternative.
Yes.
Yeah,
And so
to solve that. Yeah.
Absolutely. And so there are a lot of unique situations and circumstances, but we fundamentally believe that as these programs continue and as our partners really see the value, that if it starts with a subsegment of patients, the natural evolution is, this is incredible. Let me use it for these patients and these patients as well, because it really is it's an extension of care. It's not replacing anything.
That's a great way to put it. It is an end. It doesn't replace that primary care, that medical home model that ACOs adopt. So this is really just augmenting what's already in place to actually provide better care for the patient.
Yeah, absolutely. If you could, at its most basic, if you were saying, so what is the output of this? It is, a detailed, comprehensive evaluation of a patient, but it's also, if I was going to describe it to the physician, I'd say I am your eyes and ears in that patient's home.
Mm-hmm. Huge opportunity, I think, particularly in ACOs. As we move forward and we move through the path, whether it's with commercial Medicare Advantage payers or fee-for-service Medicare, there is a progression of moving towards more and more risk being put on the ACO. And with that, we need more tools in our toolbox to be able to manage those patients. And this is one of several, I think, that, in our partnership with Signify Health and as we move forward, this is one of several, but I think it has so much, it can create such meaningful work and really improve the outcomes of the patients that we serve.
Yeah.
It is remarkable when I think of the numbers, going back to the numbers and how many patients, whether, they only are going to see their provider when they're ill, and we know that preventative health care is really, what we're moving towards, what we need to be at, where we need to be at. This just complements that so much. Any parting comments on in-home evaluations and your perspective on where this is going to go over the next 2 to 3 years?
Yeah. I think you highlighted it a little bit, is that, at Signify, we're not just focused on the ACO or the Medicare fee-for-service or even the Medicare Advantage. We think of this as healthcare is patients and it's providers, it's facilities. And so we want and we are building a collaborative set of services that allow providers, organizations to treat all of their patients, treat them all the same, and to provide those support services so that every organization is able to deploy care in the most effective and meaningful way to the people that they're treating and the members that they're caring for and the patients that they're caring for.
Yes. So any questions, anything else you want to share with the audience?
I don't think so. This has been great.
Great. Well, I personally want to thank you. This has been a great discussion, and looking forward to the progression of in-home evaluations within the ACO market. I think there's a huge opportunity, and we look forward to our partnership. And I want to thank everyone for listening today. This has been Healthcare by the Numbers.
Thank you for joining us today. You can find more information and episodes on the show's program page. on Healthcare Now Radio. Follow the show's hashtag HCBTNPod. We are Caravan Health, and this has been Healthcare by the Numbers. Until next time, take care.